I have been practicing since May of 1988. For me, it was a calling that by the time I was 3, I was saying I was going to be a veterinarian. I've been in this practice, or I started this practice in 2021, 22. The demand by, and rightfully so, by pet owners is they want the best for their pet. They want high quality medicine. They want excellent communication skills. When I was introduced to the VetGuardian, I was like, wow, I gotta have that, because it allows us almost like a second set of eyes that is not distracted by something else going on elsewhere. It only has to be like 2 or 3 feet from the cage, from the patient, a clear view. And it does the heart rate, the respiration rate. You can set your parameters for what you want for that specific patient. And so it will alert you whether that's getting high, low, anything's changing. So it's instantaneous, where, a technician may have to go do something for 2 or 3 minutes and something's changing and they're not aware of it. So it's an added sense of security. I mean, not only are we physically monitoring them the way we always have, but now we have the bonus. They're already nervous, for example, about maybe having to leave their pet overnight if it's really sick. And of course, we give them the option that, yes, we can refer you to a specialty hospital where your pet will be monitored, and there will be people there watching your pet. Or if you don't want to do that, we have the option of using the VetGuardian. And this is what it does. And this is why we recommend it. And I could be at home. And, it's designed so that I can set the parameters of warnings and alarms for that specific patient. And so I can say, okay, I want to watch the respiration rate. If it goes above this or below this, send me an alert. But if it goes to a certain other number, then I get a warning. Same with the heart rate, the temperature. And so I'm 10 minutes away, where before I would have to tell them, there isn't anybody here after such and such time. And if something happens, it's totally out of our hands. So with the VetGuardian, I can be anywhere as long as I have phone service. I can scroll up, bring up the live video, and just see what the patient's doing. And so it's comfort for me and certainly comfort. We'll even use it for like our standard post-op recovery. I mean, on a healthy animal, that we're not expecting complications, but complications happen. And so if they have completely recovered from anesthesia, they're sternal, but for whatever reason they need to go back to their ward, put them back in there, put the VetGuardian on them, and we can be out here in the treatment room watching that patient. So instead of running back and forth, I'm just kind of throwing this number out there, but I would say that 60% of my diagnostics is observation, and the rest of it is hands-on diagnostics, things like that. And so I think the live video, you can just tell a lot. Maybe how they're sitting up, their numbers are all fine, but they're sitting up in the cage. And so that's an indication of pain. When you're talking about surgeries, your most critical points in surgery is either kind of what we call the induction phase of anesthesia or the recovery phase. When they're in surgery, of course, they're on the ECG, the pulse oximeter, the CO2 monitor, a temperature probe. So when they're coming off of that, you can't really expect that equipment to work because your patient's moving around, leads are coming off. I think that with the addition of the VetGuardian, especially for me, for post-op, it is just an added sense of security. I want the best for my patients. And so, whatever that is, whether it's through diagnostics, monitoring, just general practice of medicine. And so it just helps me feel like I'm doing what needs to be done.